everybody, to Senior Music Connection, where we discuss all things seniors and all things music. Today, my guest is Krista Ramey, and I am so excited to have her on because she knows that you are welcome. Thank you for being here. She knows so much about Medicare and Medicaid. Let me give a brief introduction, and then you can fill in the blanks that I leave. Okay. Mm-hmm. So Krista has worked most of her career in financial health care issues, over 25 years, in fact. And you work with anybody in any capacity, any social background, any economic background. It just doesn't matter. And you bridge the gap between the consumer, who is the patient, and the physician groups, the hospitals, any providers. So that is what I know, but I do want to share that the favorite part of your bio that I read is that you find joy and satisfaction in helping people, especially our seniors, navigate their way so that they don't have to choose between prescriptions and groceries.
Correct.
So I'm going to flip the camera over to you, and we've got some questions.
Okay.
And remember, just say whatever you need to say because I'm excited to get this out to the public. But
okay.
Yes.
So, we're going to talk about Medicare a little bit.
Yes, we are.
But then we may jump into some other little things, other insurances that may contribute to Medicare and how it works. So you're absolutely right. I did get into healthcare finance because I've seen such a detriment with seniors within my community that were pretty much forgotten. Or providers just don't have the time, or the social workers don't have the time. And now that healthcare has gotten to the place that it seems like it's going in a direction where it's going to be even less time. And so what we do is we leave it up to the seniors to find those resources. But what people fail to realize that if you're an individual that is of aged or have experienced a catastrophic illness, you really don't have the inability nor skill set to plan correctly when it comes to your healthcare expenses. We're going to talk a little bit about Medicare and who's eligible for Medicare. So anyone that is over the age of 65 or have experienced an eligible factor, and when I say that, I mean you've experienced some type of medical condition or disability that has now made you eligible for Medicare. Now, normally in the past with Medicare, in order to become eligible before age 65, you have to be and experience some sort of catastrophic illness. And Medicare's number one and number two qualifying factors are end-stage renal disease and Lou Gehrig's disease. Now, there's other qualifying factors that can get you eligible, but that is determined medically by Medicare. They have their own group of physicians and staff that will determine your eligibility if it's medically related or mentally related. That could get you determined sooner than age 65. Sometimes life choices push you in that direction.
Yeah.
Where no one plans to be sick. No one plans to experience something catastrophic in their life due to maybe a car injury or work or an accident on the job. No one really plans that. So there are people in place in healthcare facilities to notice that factor and point you in that direction. But do they have the ability or maybe resources to do it for you? No.
Okay, I gotcha. But maybe a social worker in a hospital could point you in the right direction.
Correct. Or your employer, your benefits coordinator.
Right.
With your employer, if they see that, there's no way this employee is going to be able to return to work. So we're going to, determine that this may be a permanent disability.
Yeah.
So what direction do we point them now?
Like an HR person.
Correct.
Or something like that. Okay, I gotcha. Okay, so that is the question, who is eligible for Medicare? Did I miss anything?
No, that would be individuals over the age of 65 or someone that becomes disabled prior to.
All right, good enough. Thank you. And how does one sign up for Medicare?
Well, there's a couple of ways. So if you're 65 and older, you're going to automatically be enrolled onto Medicare.
Okay.
If you have paid into it.
All right. Through
your employer. So we know how our taxes work. Some people don't understand all the deductions on their work stuff. Mm-hmm. So you might see Medicare, you might see Social Security or FICA or what have you be.
Right.
Those contributions pay into your Medicare.
Okay, so I have a question. Mm-hmm. What if you're self-employed?
Well, there's a couple of ways to still receive Medicare. If you're self-employed and you're one of those that pay your taxes maybe quarterly, yearly, or however you do that, that is still broken up and paid into that bucket. You can always call to inquire. Mm-hmm. It used to be, a long time ago, Social Security would send you a statement showing you how much you've contributed into your Social Security and Medicare, but you can always call 1-800-Medicare.
That's what I was going to ask next. What's the number?
Yeah, it's 1-800-Medicare.
Easy to remember.
Yes, it is. It is.
Okay.
So if you paid into those contributions on the front end, you're automatically enrolled only into Part A. But if you have not paid into it, the good thing is Medicare will give you the inability to pay into it once you've retired.
Oh, yeah? Okay.
Yes.
So if you haven't done that and you retire, then you can still put money into it.
You can pay those premiums on the front end, on the back end. Okay. Yes, you can.
Yeah.
And Medicare has several ways of doing that. And it will be based off your annual gross income. Mm-hmm. And with that, they'll determine what your premium would be, your Part A. So some of us pay while we're working. Mm-hmm. If we're self-employed or entrepreneurs and we pay our taxes quarterly or however we do it, some of those contributions are still split up federal, state, local. Mm-hmm. So those contributions can still go towards your Social Security and your Medicare. If, in fact, that doesn't happen, you still have the opportunity on the back end to still become eligible for Medicare. It's a lot of weighing factors in determining that, but there's still a possibility to get it.
Okay. See, I didn't understand that. So when I pay, I'm self-employed. So when I pay taxes, my CPA should be taking that into consideration and holding things back. And like you said, some of us aren't looking as closely as we should.
We're not looking at that because actually when you pay into Social Security and Medicare, it's broken into buckets. Mm-hmm. So you have Medicare if you're married, your spouse, you have a child that becomes disabled before the age of 18, there's a bucket for them also.
Okay.
So now that's your Social Security. Once your Social Security is determined, then they open the door and say, well, let's see if they're eligible for Medicare. Let's weigh that determination out.
Okay. So I thought that Medicaid would take care of someone below the age of 18, but that has nothing to do with it.
Well, it can. But what a lot of consumers don't look at, if you have a disabled child under the age of 18, you've already paid into that child's bucket of disability if they're eligible. Even though we're not 65 and not eligible for our benefits, your dependent may.
Yeah, just like what you were talking about a little bit ago. Mm-hmm. Yeah. Medicare enrollment is coming up.
Yes, it is.
So I am very, very curious, and so is everybody else, about what to do.
Okay, so there's more than one Medicare enrollment period.
Okay.
So you have the Medicare open enrollment period, which is from October the 13th to December 7th.
Okay, I'm going to repeat that. October 13th through December 2nd.
Mm-hmm.
Okay.
December 7th.
Oh my gosh, I even got it wrong. Oh no.
So you got Medicare open enrollment period is October the 15th through December the 7th.
Okay.
Okay. And then you have another open enrollment period, which is going to run you from January 1st and March 31st.
Okay. January to March. Got it.
Mm-hmm. This is called the general enrollment period. So you got an open enrollment period and you got a general enrollment period, and then you have an initial enrollment period. Your initial enrollment period is you're about to be 65, Medicare is aware of that.
Okay.
They're going to automatically enroll you. Now, it's important. Some seniors are still working.
Yeah, that's true.
Past age 65. So it's very important that they contact Social Security and Medicare and let them know what they're going to do.
Okay.
With their initial enrollment. Because if not, Medicare is going to go on and initiate your Part A, but they're not going to initiate your Part B.
Okay.
You have to call them and elect it.
And that is the next, it's the question that's popped into my head is, can you please explain the difference between Part A and Part B?
Yes. Now, Part A is what you initially have paid into.
Okay.
And that's just sitting there waiting on you to become of age of 65 or you become disabled. Okay. Now, Part B is something you're going to elect. So Social Security and Medicare leaves that up to the consumer to elect. That's why it seems like future-wise, you're going to have more seniors working than being retired. So a lot of them are not naturally prompt to say, oh, I'm going to call Medicare and let them know I'm still working full-time. I got benefits through my employer. I don't think I need Part B right now.
Okay.
So either way, they need to call, because if not, and you miss the window, then there comes the penalty. The penalty could be that they would do a retro of your premium and hold you responsible for it.
Okay.
However, if you you can acquire a certificate of coverage from your employer showing that you've had consistent medical coverage through that period, you won't be penalized.
Okay.
So it's important that you do that once you become 65 or older.
And nobody will call you. You have to do the 1-800 Medicare.
You have to call and either elect or let them know you're not wanting it and that you have a certificate of coverage that justifies your denial of that enrollment of that period.
And if you just don't know about that, to take initiative to do that, then it's just sort of something floating out there.
That could happen. But no one talks about that percentage of seniors that are past a income mark. Say you make over $100,000 a year, you're up in that classification of $106,000 a year. Then it's vital, very vital, that you contact Medicare and let them know how you're going to do your Part B, because your Part B is not going to be managed like your average middle class American. Yeah, Medicare has this thing called IRMA, and it's IRMAA, and it stands for Income Related Monthly Adjustments Amounts, and those are for the individuals that have made over $106,000.
Okay.
And when they go to do that, they're looking back at their income for the last 3 years, and that's terrible for an individual that has played by the rules, paid into my Medicare, paid into my taxes. Now that I'm ready to retire and sit down, you're going to base my Part B premium off how much income I've acquired in the last 3 years.
Because it's just not a picture of what's happened for 25, 30 years.
No.
Okay.
No. So for those individuals, it says which is surcharged and added to the Medicare Part B and D. So their premiums are paid at a percentage.
Okay.
It could be 40% of their gross annual income. It could be 30. It could be 20. So, your average Medicare Part B premium could be $137.50 a month. That will come out of your Social Security check. But for an individual that has surpassed that, no. It's going to be a percentage.
Okay.
And it can range anywhere from $500 to $5,000. So for those individuals, they have to weigh out, hopefully they have a financial planner that is going to have them weigh out, is this going to be cost effective? How do you see you or your spouse within the next 2, 3, 5 years? Now, every year, Medicare will go back and reevaluate, and it may go lower and lower. But if you find that you're spending out a lot in healthcare expenses, you may want to waiver whether you want to keep it or not. But even if you decide, well, I don't want to do it this year, I'm gonna look at it again next year. You're still going to look at the last 3 years.
Yeah.
So it's very important you get a financial planner, look over your resources, look over your income, and see if it's going to be cost effective to keep that Part B or not.
So medical or a financial planner would be someone from, I don't want to...
You know, I'm going to say more of a person that is helping you manage your portfolios, your stocks, things of that nature, to say, hey, financially, you can afford to pay those medical expenses within the next 2 or 3 years versus paying Medicare anywhere from $500 to $5,000 a month. They review it every year, and effective this year, it looks like they went for 2025. Looks like they're gonna. It used to be they look back 2 years, but now they're looking back 3.
Okay.
So yeah, they would definitely want to look at their income, their resources, and really sit down and look at, can I afford to carry this, the next 3, 5, 6 years? Mm-hmm. Even if you keep opting out, and you're getting 5, 6 years in, your look back is not as bad as when you initially looked at it.
I wanted to ask too, so instead of a financial planner, can they go to one of the Medicaid or Medicare buildings? There's one on kind of at 70 and 75, and it just kind of says, Medicare. It's
interesting
health.
That you say that.
Okay. Because
what a lot of consumers don't know is that a lot of vendors throw their hat in the ring to get grants or funding to educate consumers on Medicare and how it works. Mm-hmm. So a lot of them don't really have the experience on the front line to know how that's going to affect you in your pocket.
Okay.
So the thing is that, it's a good place to go to be informative, but it's no more informative than your Medicare book that comes out in the mail each month, every year, your Medicare and You book. And you read over it. But a lot of people will say, okay, I got all this information, but how am I going to apply that to my everyday? Mm-hmm. How am I going to utilize this for my prescriptions? I have lab work every 3 months, annual x-rays. How's this going to work for me? So I would say if you are your average working class American, definitely make sure you elect your Part B and A. It may not make sense to you at the time if you're still working and a senior, but it will in the long run because no one can plan to be sick.
Right.
So if you didn't put savings aside for that, you want to make the most informative choices that you can. You can never have enough coverage.
Yeah, and savings is so hard to do because we're all just kind of living day to day and month to month, so saving is difficult.
Because some people will not do the Part B because it's not cost effective for them. You may only get so much from Social Security.
Right.
So then you're looking at, well, I can't afford that $137.50 to come out of my Social Security check each month. I just can't do that. Well, you don't want to do that. That's when you want to start looking on a local level of programs and organizations that may be able to assist with it, like Medicaid.
Right. I wanted to get into that a little bit. I want to make sure that I'm not jumping too much out of order. But the whole Medicaid and Medicare situation, if you can just speak to that, just try to explain it the best you can.
Well, the sad part about it is most seniors, believe it or not, and most positions I've acquired has always been on the front line. So believe it or not, most seniors will not apply for Medicaid. Mm-hmm. They think that, Medicaid's going to come from my home or Medicaid's going to come for all my resources. And that's just not the case.
Okay, so it's not a spend down or anything like that?
Well, it could be. Potentially, it could be. But here's the thing. If you're at a state where you just can't afford to pay your premium, then you've already reached a point that you need assistance. Mm-hmm. So the thing about Medicaid is they're both governed through Centers of Medicare and Medicaid. So they're both federal programs. However, when it comes to Medicaid, the federal government gives your state the ability to manage it.
Okay.
So I always tell taxpayers, I don't understand why you would be afraid of Medicaid. You've been paying for it.
Yeah.
You've been paying. Our state, Ohio, 70% of Medicaid funding comes from the federal government. The other 30% comes from us.
Okay.
So it's something you've been paying for. You just got to enlighten yourself on how to use it.
Yeah, because I always think of it as, there is zero more money and, then you're on Medicaid. But what I hear you saying, I think, is that you can sort of do both at the same time?
Yes, you can. Okay. You can, when it comes to Medicaid, you can own a home.
Okay.
You can have a car. You can have a bank account. It's a lot of things that you can still obtain and have while getting assistance. And the good thing about Medicaid, once eligibility has been determined, then the door opens for other lines of services that you may be eligible for.
Oh.
There's Medicaid waiver.
Right.
That would help you with home-based assistance if you needed a nurse aide or a bath aide, Meals on Wheels, Life Alert. It opens more doors to you if you went that route.
That's interesting. I've heard of something called Passport. Is that one of the
so
things
Area on Aging manages Passport, and that's a whole different funding.
Okay.
So that's managed at a state, county level.
Okay.
Medicaid has so many trees to it of services that it offers. People think it's one generalized Medicaid. There's several types of Medicaid. You have alien Medicaid. That's for individuals that are not American citizens. There's presumptive Medicaid. People that have experienced a catastrophic illness, rush to the hospital, no insurance. That's presumptive. It's going to cover for that situation. Then you have waiver. That's home-based. It'll offer assistance in keeping the individual in the home.
Okay.
Instead of having to go to assisted living or nursing home. You do have the Medicare Resource Center that can help over on 1 Elizabeth Place in Dayton, Ohio. You could definitely go over there. You can call the 1-800 Medicare number. You can call the Ohio Department of Insurance.
Okay.
They offer assistance in Medicare programs. That would inform you also. And then the 1-800 Medicare number is 1-800-633-4227. They can always call that line. It may be a wait.
Yeah.
But they sometimes give you an option where you can leave your information and they'll call you back.
Yeah, that's helpful.
And I think they're open as late as 8 p.m.
Oh, wow. Well, that's good. Are they 8 p.m. in whatever time zone you're in?
Yes.
Okay.
Now, for us, for Ohio,
right,
open till 8 p.m.
Right. Okay.
And then there's several of your nursing home facilities that helps too. And a lot of them give in-service programs too. Or they'll have a teach and learn or come in and do a little conference with you or lunch and learn about Medicare during the open enrollment period. But one thing I advise seniors to never do, during open enrollment period, you're going to get so much mail about Medicare Advantage plans. Do not choose one if you don't know how your traditional Medicare works. You want to first understand that. Then you'll be able to navigate and choose a plan that works for you.
Now, 1 Elizabeth Place, yes, in Dayton. What about any area on aging?
I believe there's another area on aging is sectioned off per county.
Okay.
You have Montgomery, Greene, Hamilton. They all have an area on aging.
And somebody can go there and get the help that they need?
Yes, they could.
Think? Okay.
They also have a consumer line, and that number is 937-341-3000.
Okay.
And they can call that line for assistance too.
Okay.
So when you get into area on aging, you're saying that to them when you call, you may need assistance home-based.
Right.
So
right, like the therapies and everything.
So if you need assistance home-based, area on aging will come out and assess.
Okay.
To see if there's a need. You have to meet a level of care in order to get assistance with that need. Now, the only interesting thing I find about that is, now it may have changed, but I know Montgomery County was the only county I noticed that had additional funding.
Okay, Montgomery.
For individuals that may exceed over the federal poverty guideline or choose not to apply for Medicaid. They may receive some form of assistance through that county that would help with home-based assistant programs.
And that's just Montgomery County.
Yes.
Is that something that the public votes on? How does it
Yes.
come about? Oh, yeah?
Yes.
Is anything
So you got to
happening
pay
this
attention
voting?
to those issue 1 and 2 and 3, because a lot of those it could be another grant-funded program that assists with that. Now, I know you were asking about the difference between Medicare and Medicaid. We talked about the premiums and how that would waiver. We know Part A, your premium will come out, it's a given.
Right.
You don't have a premium. You paid for that while you worked.
Right.
However, individuals that haven't paid enough or haven't can pay it on the back end once they retire also.
Okay.
Then we talked about the Medicare B. But we didn't talk about is the services that it covers.
Okay, well, let's talk about that.
So Medicare Part A covers your inpatient hospitalization. It covers skilled nursing, home health, some minimal home health care services, inpatient hospice.
Yes, I was going to ask about hospice.
And some inpatient psychiatric, it just depends. Emergency dental,
Okay.
it will cover that. A lot of seniors didn't know that. But Medicare A will cover an emergency extraction if it's medically related.
Okay.
They will cover that. It also covers behavioral health. It covers preventative screenings. Medicare A covers substance abuse. It's a lot of things that Medicare A will cover.
Yeah.
And that's in your Medicare to Know book that you get in December. You might be getting it now because November is right around the corner. Part B covers a lot of your outpatient specialty visits, physician office visits, x-rays, lab work, outpatient surgeries, outpatient mental health, medical supplies. Now, some of that might go under your Part D, but some may go under your B too.
Yeah, and we didn't really talk about D.
Ooh, D. D is a naughty little thing.
Okay, we're all ears though.
So Part D, you definitely got to elect it. You got to, else they're going to choose one for you. Now, this is where I say the system is flawed. Medicare D, yeah, you pay into it, or you have an inability to pay into it, right?
Right.
It will never let you have a secondary.
Okay.
It will never let you have what they call Medigap to step in and pick up those copays from your Part D. It won't.
Okay.
So
why would someone use? In what circumstance would you?
So your
find
Part
that
D
helpful?
is what's going to cover your pharmacy, your medications.
Okay.
Or medical supplies.
Okay.
In-home based type of medications that you're getting, or even in a nursing home, your meds are billed through your Part D.
Okay.
So the thing I find fascinating with Medicare and how they manage Part D is the consumer is already paid into it, correct?
Right.
So that means that now you got to elect a drug prescription plan. So you're going to have all these providers coming at you: Humana, United Healthcare, Medigold, WellCare, Buckeye, Molina, and I can go on and on and on. They're going to send you a packet out. It's very important that you keep a list of your medications.
Yeah.
Because those drug prescription providers have what you call a formulary plan. And you want to go straight to the formulary plan and look and see if your meds are on that list. If they're not, that's not a good plan. If they are, then, that's a good plan. But now you're wondering, well, how much more out of pocket am I going to spend,
Right.
And that's the crazy thing that we, as America in this country, we need to work on. Because no one talks about Medicare D, even with this election going on. They were talking about how in the next 5 years, they're going to get some of the medications considered as a maintenance medication. The private sector been doing it for years.
Yeah.
How is it now that we're now going to look at it for seniors? And you got a 5-year plan. Some of them won't live long enough to even get it.
Yeah. I know.
So that's, to me, I think is unacceptable for our country. If we have the private sector proving that it works, I don't know why at a government level we don't.
Right.
For us, the working class citizens, our employer provides us health insurance, and we choose whatever plan that works for us, right?
Right.
But with that, it has a formulary that no one talks about. Your health insurance company has a pharmaceutical rider on your plan. And that rider determines what will be covered and what will not be covered.
Right.
What will be classified as a maintenance medication and what will not. And what really saddens me is that your average American, let's say you work and you got a good insurance plan.
Right.
That has a good pharmaceutical rider. So if you got high blood pressure, diabetes, or whatever the case may be, 80% of your medications that you take daily are considered maintenance. So that means that cost has been capped.
Right.
So you won't get into that astronomical pain out of your pocket. But for seniors, they don't have that choice.
Yeah.
So their insulin might be, I don't know, $200-$300.
Yeah.
Every refill.
I know, and it's just crazy the amount of money.
But it can be capped.
Yeah.
We've already proven it.
Yeah. So you're saying that's what the federal government
should.
Mm-hmm.
They should have been looked at that.
Yeah.
You know, if the private sector can prove that they can cap and consider medications maintenance, then why couldn't it have happened on a federal level for Medicare?
Yeah, I don't know. Red tape, and I don't know, it must benefit somebody.
I don't know. I just think that is something that we should hold our local and state officials more responsible for and looking at and seeing how we can manage it. Even if we can't do it on a federal level, maybe at a state level. I don't think that your average blood pressure and diabetes medication should be an open field for anyone to just price gouge.
Yeah, in your bio, you said, you don't want people to have to choose between groceries and
that's what happens. And that's what drums up the cost in healthcare expenses, because if you're telling your senior, if you're your average American and you have to have this insulin or you have to have this blood pressure or heart medicine, and you're wavering, well, I need groceries.
Yeah.
But you're going to get your medicine.
I know.
Or you might waver and not get the whole bottle, your whole 30-day supply. Maybe you get a 15 or a week. But they're going to end right back in the hospital. Now with Medicare, they've expanded it. The laws changed a little bit. So when you have Medicare recipients going to the hospital for a condition that they were treated for, and then they return within a allotted window, that hospital don't get reimbursed for that anymore.
Yes, I remember that from my days at hospice.
They don't.
The return, there's some word for it. You don't want patients to return and return and return.
Well, there's no reimbursement. But here's the
why.
thing. What hospitals should be looking at, if you have those frequent flyers, then maybe you need to beef up your resources in social services areas to get those individuals and get a hold of them and say, hey, are you getting the proper assistance with your medications?
Right.
Do you need a secondary insurance? Because, most of the hospitals within this region, and I can tell you, because most of them I've worked with or at. Mm-hmm. So they have a financial counselor that's going to look at their payers and see if there is going to be a resolution of payment. They're going to look at that patient as an account, not as an individual or social issue.
Yeah.
So their job is to look at it and say, well, we got to guarantee payment for the services that are offered. And if they have a Medicare Advantage plan or just traditional Medicare, they're still going to have an out-of-pocket. Well, there may not be a time length in their stay to figure it out. Or that hospital, outpatient facility or what have you, may not have the resources or the individuals there to catch those individuals.
Right.
But if they paid attention to their deficits, they'd see it's important to have that up front. Not just a resolution of payment for the facility, but also for the patient. Because now if you know they're going to be a frequent flyer, you've covered all bases.
Yeah, so if they are properly, spoken with and understand what's going on, then they can get medications and the help they need to stay out of the hospital. Okay, and that makes sense.
Because even though Medicaid is an option, a lot of seniors are just not ready for Medicaid or don't feel comfortable. Well, there's a lot of pharmaceutical companies that distribute your medication that have waiver programs too and grant programs too that can assist in paying for your medication. So let's say I take a blood pressure medication that is very expensive, so I can't afford to get my full 30-day supply. But let's say Johnson & Johnson is the manufacturer of my meds. They may have a program that will offer assistance and send me that card or whatever I need to take to the pharmacy, and that's where my discount would happen. But when it's not out there and it's not informative for seniors to know,
right,
then they don't know they have that option. There are some good pharmacies that do, or some pharmacists that will say, hey, you take, I don't know, Dimetap or what have you. Here's a number to the manufacturer. They have a waiver program. You fill out the application, they may give you 60% off this medication.
And that's why it's good to have a pharmacy or a pharmacist that you have a great relationship with, that knows their stuff, so that you just don't walk up to the counter, buy your stuff, walk away, and they didn't tell you.
If you have a strong medication list, right? It'd be nice if you had someone, a family member or someone, go over your med list. You can always Google those medications to know who the manufacturer is, and you can submit to them in writing, asking, do or call, and ask, do you have any programs that will offer assistance with my prescriptions? 80% of the time they do.
Yeah, I don't think people know that. You were talking about adult daycares and how that's going to help so much. I didn't understand at that time what you were saying, but you were on a roll.
Well, I think adult daycare is the wave of the future. I really do. With the monetization and spending in Medicare, they're already not reimbursing the hospitals when you're in and out for the same thing. They're not getting paid for that. Nursing homes, their reimbursements are not as much as it used to be. And then I'd say your average American wants to keep their loved one home for as long as they can. So in order to even think about going in a nursing home, if you're not a millionaire, you're going to need assistance. Unless you got with the right broker, the right financial planner that's going to help you be set up with maybe another form of insurance that will assist with nursing home. And there are some out there. There are insurance plans that will pay for your nursing home stay where you don't even have to apply for Medicaid. But 60% of the people in this region don't have that or can't afford it. So the thing is that if you apply for Medicaid, you may have to spend down for Medicaid. You may, the allowed resource amount, I believe, the last time I checked, for a couple was $3,000. So if you have anything saved over $3,000, or you have IRAs or CDs or things of that nature, you do want to consult with an attorney to help you maybe be able to put some of that in a trust.
Right, in a trust. That's what I've heard, to protect everything. Is there a look-back period?
5 years.
5 years. So,
but you can put, I believe, last I checked was up to $123,000 in a trust. That's really not a lot for two individuals to live off of.
Right.
And so some seniors get intimidated and say, I just don't want to do it. Well, your other option would be to see if you can apply for nursing home insurance and pay that a premium. Because if it came down to it and you had to go, then there's an insurance that would pay you for being in that nursing home.
Is that something you need to pay into for a long time, or can you pay into that right as it's happening?
I'd say get it today if you could.
Yeah, yeah. I have a friend that has that. And, she says, oh, I hope I don't have to go. But if I do,
and it's very smart planning. I'd say anybody age 50 or older, start looking into other insurances that will pay for inpatient nursing home stay, because Medicare exhaust, it runs out. Does not continuously pay in a nursing home.
I know I've known people that are in really swanky nursing homes, and then their money's gone, and then they have to move somewhere else.
Yes.
Yeah, and that's really hard.
Well, there are still good, solid, caring nursing facilities that are very nice.
Yes.
For an individual to stay and receive the same quality. No nursing home should be basing quality of care off the inability to pay. No nursing home should be doing that. But the more swanky ones, the private pay ones, there are some out there that are nicer. However, they're very expensive. Inpatient, skilled nursing, no, I'm going to say long-term care.
Right.
Because that's what you're going to be. So inpatient long-term care can run you, in this region, anywhere from $9,000 to $13,000 a month.
I know. People are shocked when they hear that.
And that's just room and board.
Yeah.
That is not any other ancillaries like Depends, nutrients, shakes, things like that.
Or assisted living.
Wound care.
Yeah.
Now that's different. Assisted living is a little different than long-term care, because you don't need as much around-the-clock supervision.
Right.
That's more of you need help with your independency, but yet you still have some.
Yeah.
So you have people more of checking on you, making sure you take your meds, letting you can come down to the dining area to eat. It's a whole different type of living.
Right.
You got independent living, and you got assisted living, and then you got nursing home. So it's like a transition almost.
Yeah, it is. And CCRC is, I forget what it stands for, but it means that you have it all. That a facility would have it all. Everything that you just talked about.
Right.
So it's important it's great if you can get into a home that has all the levels of care.
And that can take you through those stages. I mean, like I said, the goal with any American is to keep their loved one home as long as they can and get the resources that are home-based. I mean, even if we got into our veterans, that's a whole nother story.
Oh, man. Whole nother show.
And services that are offered to them, too. But I think the average thing is to keep them at home as much as we can. So the reason I was talking about the daycare and it being the new wave is because if you want to keep mom and dad at home, but you work.
Right.
And eventually you're going to have to do the Medicaid. That's a way of spending down.
Yes, that's what you were saying. So you can spend that down. Hopefully everything else is in a trust.
Yes, because, the good thing about Harmony, I think they're there anywhere from 6 to 8 hours a day.
Right, yeah.
Which I thought was wonderful, because your average person working 8 hours.
Yeah, that's true.
So if it's somewhere I can take my loved one and they be cared for and fed, and not only that, have a clinical staff.
And socialization.
Yes,
friends.
It's awesome.
Yeah.
And I'm spending it down, preparing me for if they do have to do independent living or assisted living or nursing home, and I need Medicaid, then I've spent down appropriately. And what people don't realize, even if you have a loved one that's in independent living, they still can go to daycare.
Yeah,
they don't have to be in that facility all day.
Okay.
So if you have them in independent living and you need to spend down for Medicaid, then you can send them to daycare 4 to 6 hours out of the day and be more active.
Is daycare for people with memory care, dementia, or... Because that's kind of what I thought of.
It just depends on what they're offering. Now, for Harmony, the wonderful thing is that they do evaluations on the type of patients they can accept, because you want to be able to provide the service.
Right. Something that's beneficial.
Right. So, when you get into dementia and Alzheimer's, that's a whole nother level of care. And most, I'd say 100% of facilities want the clinical documentation to review to make sure that they can provide the service to that patient. Any individual that's going to offer services to seniors should do an evaluation to see if they can provide the service that they're asking for. No different than Area on Aging. They're going to assess you before they determine what services they can offer you.
I also wanted to say, might switch this around, that when people are looking for health fairs and things like that, a lot of senior centers have them, and we have a lot of senior centers around here, and hospices and senior fairs. I know that there's one actually at the Art Museum every year. So if you just kind of keep your eyes out for things, then you can get with professionals that know what they're doing and hopefully get associated with people that can help.
I'd say health fairs are great for seniors to go to, and I would also say whoever you have as your power of attorney, or may that be one of your children or nieces or nephews or whomever, take them with you.
Yeah.
Start rolling them into that plan that you have and how you want your health care to be managed.
Right.
Make them, if they're going to be your POA, they're going to be accountable on how the healthcare system is going to work for you. When you transition into any type of service, whether it be daycare or independent living or assisted living or even nursing home, it's vital you have a point person that can manage that for you if you don't have the physical inability to do so.
Is there a medical power of attorney and then also a power of attorney, or is it financial power of attorney?
There's medical, financial, and doable. That means they have both medical and financial.
Okay.
But power of attorney is not in void if that individual still can make their own sound decisions.
I was wondering about that.
Yeah, it only comes into play if the individual cannot make their own sound decisions.
Okay, so it's no harm for anyone to sign the POA. And
no, and you can have anywhere from 1 to 500 POAs.
Oh, wow. See,
yeah, so it's always good to have a backup plan. Because by the time you get to the nursing home for long-term care, it's too late for a lot of things. So you definitely want someone that can articulate and make sure things are managed in the way that you wanted it to happen.
Yeah, and that conversation needs to happen early.
Very early on.
Thoroughly.
I would say anyone over the age of 50 should have a living will and a power of attorney.
Yep. I signed mine when I used to work at hospice. They said, sign this now. So my sister's in charge. So Michael, that's my sister's name. Get it right.
So every year when you go over your benefits or your life insurance, all of that, your POA should know where it's at, where you keep it, and is it updated.
Right. Well, these are very important things. And I just thank you so much for coming on. And I wish I knew better questions to ask.
No, you're fine.
I wish I did. Well, we're going to be showing a PowerPoint side by side for our audience. So I will make sure that all of these slides get on.
Yes.
Is there any slide that we need to make sure you speak about?
I think in the slides you're going to get a bracket that shows you about Medicare and secondary insurance and Medicaps, which we didn't talk much about, but it'll be a little bit more descriptive for you to let you know how Medicaps work, because a lot of seniors don't really understand it. They know that if I carry traditional Medicare, I can get ARP as a supplement, or maybe Anthem, or maybe Medigo. Maybe I can get a supplement to pick up these copays. And that's wise to do depending on the cost. And is it cost effective? But the bummer of it is it's never going to pay copays to your prescriptions.
Oh, yeah.
And it should. I don't know why that's not happening, but right now you're never going to find one.
Oh, man.
That's why a lot of seniors will continue to work and keep their employee group health plan through their employer, because they know they have that pharmacy coverage that, whatever they Part D doesn't cover, their insurance will.
Yep. Now that I understand pretty well, having been in the workforce and everything. So
Well, the employee group health plans are wonderful till you go to retire.
Yeah.
Then it changes up a lot. The premiums become more expensive.
Yep.
The out-of-pocket expenses become more expensive. And I always tell people, even though you're retired, if insurance is offered through your employer as a retiree, do not drop your insurance.
See, I didn't even know that was an option. So
Yes.
some places will do that for you?
Yeah, like city, county, state workers, they retire, federal, they still get to keep their insurance,
Nice.
their health insurance. But it's not going to work as great as it did as a full-time employee.
Okay, it's a little bit
So a
less.
lot of them will say, well, for me and my spouse, our premium is $2,500 a month or $3,000 a month. I don't know if we can afford that. So before you decide to drop it, you're going to have to take a long, close look at medically what you both got going on, where your medications are, what are you paying out in that. Do you see the need that you may need additional health care down the line? It's a lot of things to weigh out before you drop insurance. Don't ever just drop your insurance because you can't afford it.
Yeah, because of that. Because it might turn out worse.
Or there could be there could be programs that could assist you.
Right, like what we were talking about, where you call the manufacturer directly. Okay.
Those medications there. Then you got the wonderful marketplace that you can go through and see if that's going to be cheaper
That's true.
than what your
Yeah.
employer is offering you. So you don't want to always just drop insurance. And then when you got that gap of no coverage, it's hard to get anyone to cover you. That's why that certificate of coverage is so important.
All right. Anything else?
I think that was it in the bracket of just things of discussion, which I'll get to you.
Okay. Oh, I know. So, can people come to you for help in addition? You were talking about that, that's kind of what you like to do, or was that something that you used to do?
Well, after COVID, I kind of slowed down a little bit.
Okay, sure.
But I do have an email address that you can email your questions to.
Okay.
And that's RameyKrista@iCloud.com.
All right, and I'll put that up on the screen.
And I can get back with you on those questions of any concerns that you have.
Yeah, or at least point people in the right direction.
Yes, ma'am.
But you'll probably know the answer. So I really thank you.
You're welcome.
It's just amazing what you know. Like you've been in it for a long time. And
Very
you
long time.
understand
Very
all
long
of it.
time.
That's great. It's
And
great service.
I can definitely tell you Ohio has a bigger percentage census-wise of senior residents than ever this year.
I did read that in your bio. I don't remember the numbers, but do you know it off the top of your head?
I used to.
That's okay.
But I can tell you that we have a very high senior in our census of seniors. So, I know a lot of people think, well, I'm not old, it's not going to affect me.
I know.
Or it's not going to matter to me, but it will.
It will.
Because when we are not concerned about our seniors and getting assistance and programs out there to aid and assist with the things that they need, then that trickle effect happens. Because if the hospitals lose, and they lose in not being reimbursed, then they can't stay. They can't stay in operations.
Right.
So, even your doctor's office and your specialty groups and your outpatient surgical centers, they lose a lot of money in indigent and individuals without the inability to pay. But if we can get more funding and grant programs in place in the right areas to capture those individuals and offer them those lines of services, then it would be very cost effective to us all.
Yeah.
Because when healthcare expenses go up, what? The consumer pays more.
Right. It affects everybody. And my thing is, we need to take care of our seniors. They have
Yes, we do.
paved the way. They
Yes,
have
we do.
lived the
Yes, we do.
life. And so it's important to take care of our seniors, which is why I do this podcast for all things music and all things seniors.
Wonderful.
Thank you so much for coming today.
And thank you for allowing me.
Well, you are welcome. Hopefully we will help some people.
Yes, we will.
All right.